I'm here for another Choose a Career segment, and today we're here with Parker, and you're going to talk about physical therapy as a career. So tell us a little bit about physical therapy.
So physical therapy, it's obviously all about movement and getting people back healthy and improving their quality of life. Some people come in with an injury, a specific injury. Some people come in with can even come in with general weakness or just a lack of mobility. And that's what we're there to help them, reach their goals and improve their quality of life overall.
Okay, tell us about the education side of physical therapy.
Yeah, so there's a pretty good bit of education. Obviously, you've got to graduate high school first. From there, you got to get your bachelor's degree, which is typically a 4-year degree. After that, you apply to all your PT schools, and usually more than one. Hopefully, you get accepted, and from there, it's a 3-year degree. So typically, it takes about 7 years total.
Okay, what type of degrees should people be looking at for bachelor's? I know it seems like science degrees are typically pretty popular.
And that's kind of like what people typically think is, I need to go science-based, or kinesiology is a big one. That's kind of one people go after because that's movement-based and kind of what a physical therapist is doing. But PT schools, our professors who do our interviews and stuff, they even mention they like things that stand out. They want some people who are different. So there's all kinds of people who go into finance, business, who get into PT school if that's what they end up finding out they like doing. So that's typically, I did the kinesiology route, but some people go another route and it still works out. But you do have to get the prerequisites of science-based classes, chemistry, biology, physics, all those things, and A&P. But other than that, you can get a degree in anything you want.
Okay, tell us about PT school specifically. What's it like?
All right, PT school, you got to go in. You got to be prepared and be ready. It's obviously the 3-year degree. Some of those is classwork and schoolwork. Some of them are in the clinic with your clinical instructor and kind of learning hands-on.
What types of labs and clinics exist in PT?
Okay. There's obviously learning how to do manual therapy techniques, stretches, joint mobility, therapeutic exercises, learning how to perform the exercises, teaching people how to use a walker, a cane, crutches, things like that, just mobility overall. And then obviously you speak on just hands-on stuff, all the hands-on things that we have to do and things like that.
Okay. Once you graduate and you are a physical therapist, I think most students only think of the athletic side of the world when it comes to PT.
No doubt.
Physical therapists are in pretty much every medical field. I know that if you even people who have foot injuries or anything like that who are not athletes end up seeing physical therapists. So where all can you get a job?
Okay, yeah. PT is for everybody, not just athletes, not just the older population or anything. It's just anybody who is, needs to improve their life physically and move better. There's all kinds of different places to get a job. I work at an outpatient orthopedic clinic. We typically see orthopedics, but we also see other things to get people up and moving. You can also get jobs at hospitals in acute care or an inpatient setting, skilled nursing facilities. There's all kinds of different routes and things like that to get with physical therapy. They even have some physical therapists who work with horses. It's kind of crazy. I've never gotten into that, but I don't know if that's around here. If it was, I'd be interested to see it.
Right. So people who've had any type of surgery typically have to have some sort of physical training and therapy after the surgery. So it's really a wide open market and plenty of job opportunities.
That it is.
All right. What can people expect to make? Because that's the first thing that students are probably thinking in the back of their minds.
Yes.
I'm assuming because it's such a widespread field that the salaries are all over the place.
Yeah, it varies. Obviously between the setting and if you're in a hospital, you tend to make a little bit more.
Because you probably have worse hours.
Yes. The hours you're getting there early, you're staying there late and things like that, and working through lunch sometimes. But the starting entry-level PT salary in Mississippi, I kind of looked this up, it ranges from like 65 to 75 typically. And then that on top of that, typically they do incentives between how hard you're working with your patients, how much improvements you're getting them. Our clinic specifically offers incentives like Are patients meeting their goals? Are they showing up? Things like that. So there's obviously things, add-ons on top of your salary as well, which is nice.
Okay, but that salary start is definitely above average for the state of Mississippi.
Yes, it is. It is nice. So obviously a lot of schoolwork, but it ends up paying off. So one of the first things when patients come in, we evaluate them, and with that evaluation, we do a movement assessment, and it also consists of getting objective measurements. One thing we use as a physical therapist is a goniometer, which is how we measure the range of motion in a joint. So that's kind of works there. There's different places we put it on the body: shoulder, knees, hips, ankles, things like that. We also use the tape measure here to measure like girth or swelling on somebody. So I brought those two things today to show. And then from there, I'll show you some of the manual therapy techniques we use to help, whether it be get muscles to relax or help somebody who's having some pain. We sometimes use the massage gun on patients, depending if it's what we think is best for them. So that there's a few different settings with it. Typically, I stick with the lowest, and I don't go too deep. I don't want to cause pain. I just want people to feel a little bit better and get relaxed. So that's that there. And then two new things I've incorporated in my tools this past year. I've got certifications in myofascial decompression, which is these cups here. Place them on the body. And then it kind of decompresses the tissue, helps glide and slide a little bit better, and gets those muscles moving more efficiently. Same thing goes for this here, is an instrument-assisted soft tissue. What I do is I kind of just massage with this instrument here. Kind of helps out my hands, and some patients really like it because it's able to get a little bit deeper. And then one thing most patients love this here. This is an E-stim, electrical stimulation. We use it for a few different things, whether it be to control patient's pain, bring it down. But we also use it for strengthening purposes. It comes with electrode pads. We use those pads, we place it on the muscle joint wherever we think is best needs for the patient. And then we pick the setting, and from there, we go from there. We crank it up, not too high, but not too low. We want it to feel good for the patient, but not cause too much discomfort. Most patients really enjoy that and love that.
Well, thank you so much for visiting with us today. If anyone is interested in physical therapy as a career, what would you suggest they do?
I would first suggest, obviously, do your best in school, finish strong in high school. From there, reach out to your counselor or just anybody in general to help plan and get your priorities in line and stick with that plan. Find a mentor who's in the field or who's interested to help you. From there, look up schools that you would be possibly interested in and see what you have to do to get into that school, and stay focused and go after it.
All right. Well, thank you so much.
Yes, sir. Thank you.